right, Mr. Monroe, are you ready to go ahead and get started with your examination?
Yes, I am.
Okay, well, it's good to see you today.
Thank you.
I apologize for the circumstances. It looks like you had a fall at home.
Yes, I did. A few days ago, I was bringing in groceries from Costco. I thought I was at the top step. There was one more step to go.
Oh, okay.
I kind of tripped. Having a little issues with my right side. I would say my shoulder, my elbow, and also my right knee as well.
Okay. And what symptoms are you having exactly? Is it like pain?
A little bit of pain, some swelling, and some soreness for sure.
Did you happen to hear any kind of popping or clicking when you fell?
No.
Anything that would indicate a dislocation or a break?
No, there was no clicking or popping. I don't think
Okay.
anything's broken or dislocated.
And no extreme pain with mobilizing or with your like disturbance in your gait or anything like that?
No, it's not extreme.
Okay. All right. Well, according to the RN at intake, your vital signs were stable, which is good news. So no issues with that.
Okay.
Is the height and weight on file correct?
Yes, it should be.
Perfect. So just to get started, I have a couple questions. I'm going to be testing your cognitive ability, see if you have any kind of cognitive impairments happening. Okay. You didn't hit your head, correct?
No, I didn't.
Okay, so if I could have you repeat 3 words for me.
Okay.
Lamp, bed, window.
Lamp, bed, window.
Okay, so these are all items in this room. There is a lamp, you're on a hospital bed, and there is a window in the room.
Yes.
I will be having you repeat these words to me a little bit later on, okay?
Okay.
Can you tell me what today's date is?
Sure. Today is May 19th, 2023.
Perfect. And can you tell me what you had for breakfast this morning?
Yes, I had scrambled eggs, I had potatoes, and I had turkey bacon.
Very good. And what about what you had for dinner last night?
Last night I had mashed potatoes, green beans, and shrimp.
Very good. Okay, and can you tell me what the name of the street you grew up on was called?
Sure, I grew up on Robinson Lane.
Perfect. That was testing your long and short-term memory, which both seem to be intact. Do you have a history of any blacking out periods or seizures?
No, I don't.
What about visual impairments aside from the glasses, like floaters or blurry vision, double vision?
No, just the glasses.
Do you have an astigmatism?
No, yes, I do actually. I do.
Okay. Any lack or loss of mobility or coordination? Have you been clumsier lately? Noticing a lack in flexibility?
No, just this one time.
This is just kind of like a happenstance. It's not something that usually happens. Do you remember the last time you fell prior to this?
Actually moving into this house about 2 years ago. The same thing with the step.
Okay. Gotta be careful with those steps.
Yes.
Okay. All right, well, if it's all right with you, we will go ahead and get started with the exam. The last portion of your cognitive test is going to be having you repeat back those 3 words. Do you remember what they were?
Yes. Lamp, bed, window.
Very good. So I'm definitely not noticing any sort of neurological deficits as far as I can tell, okay?
Okay.
So let's go ahead and get started with the physical portion of the exam. I'm going to be starting with a head exam. I know you said you didn't hit your head, but it's still good for us to check for any sort of bumps or lesions or anything, okay?
All right.
Excuse me while I just clean my hands.
Sure.
Are you in any pain or discomfort at this time?
A little bit. My shoulder. It's a little bit of tightness.
Okay. And have you been taking anything for it?
Just regular Aleve.
Okay, perfect. Aleve is definitely what I would recommend. It's going to help bring down some of that inflammation. I know you said you were experiencing a little bit of swelling.
Yes.
Okay, so I'm just going to have a look at your head and neck areas, and there's no kind of sensitivity or any pain in this area as
No.
far as you're aware, correct? Just feeling around for anything that might be notably abnormal. It's not likely that you'll have a head injury. Normally, when you hit your head, you know right away. And since the fall, have you had any headaches?
No, I haven't.
Any pain or discomfort in your ears? Does all of this feel okay?
Yes.
Can I just have you lift your head slightly? Okay, you can go ahead and relax. I'm definitely not noticing any swelling
Okay.
or any bumps or abnormalities in your head, which is good news.
Okay.
Just take note of that. Let's go ahead and move on. While I have you laying down, I'll go ahead and do my initial physical assessment here on the parts of your head.
Okay.
So I'm going to be testing for nasal patency. Basically means I'm testing for any occlusions in your nares, whether or not you're able to normally breathe through both sides.
Okay.
So I'm going to include one side, and I'll have you take a breath in for me. And the other side. Okay, and that all sounds clear to me. Did you notice any obstruction?
No, I didn't.
Okay, perfect. If I could have you just open your mouth for me, I'm just going to have a look inside. Does it appear that you might have chipped any teeth? Teeth look good. Stick your tongue out for me. Okay, mouth and tongue both appear totally normal. Just going to have a look at your ears. Looking for any signs of bleeding of the ears, anything that might indicate an injury to your eardrum, but I think we're okay here. So I'm just going to do a very, very brief hearing test to make sure everything's intact there, okay?
Okay.
Can you tell me if you can hear this?
Yes.
And this?
Yes.
Tell me when it stops.
Stopped. Stopped.
Perfect. Can you hear this?
Yes.
Tell me what side you hear it on.
Right side. Left side. Right side. Right side. Left side. Both sides. Left side. Both sides.
Very good. No issues with your hearing. Is it all right if I remove your glasses for just a second?
Yes.
If you hold on to those. I'm just going to have a look at the area around your eyes. No symptoms of sensitivity, any kind of sensitivity to light or anything like that?
No.
So if you open your eyes for me, I'm going to be shining a light in your eyes. I'm just checking for pupillary reaction.
Okay.
Direct and consensual response appear to be within normal limits. Okay, so I want you to track for me. Keep your head midline and follow the light with your eyes. Any pain or discomfort with that?
No.
Okay, very good. So now I'm going to be testing your peripheral vision. I want you to keep your head and eyes up at the ceiling. I'll be moving my fingers at the sides of your face. I want you to say yes when you can see my fingers moving, okay?
Yes. 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 Yes.
Very good, no issues with that. Lastly, for your eyes, have you hold this over your eye. I'm going to remove the cover on this side. Can you tell me how many fingers I'm holding up here?
I can't see it. 2. 2. Can't see it. 2. 2.
Okay, switch for me.
Okay. 2. Can't see. 3. 2. 2.
Okay. So I'm going to try that again with your glasses. Can I have you put your glasses on for
Sure.
me? Ready?
Yes. 2. 3. 3. 2.
Okay, go ahead and switch.
2. 3. 2.
Okay. So you did a lot better with your glasses, but there does seem to be a little bit of a discrepancy in your peripheral vision. I would guess that you probably need to have your glasses updated. When is the last time you saw your optometrist?
It's been about 2 years now.
Okay. So I definitely recommend having an appointment with your optometrist so they can have a look at that. And just going to do a quick test for color deficiency. Do you see any colors here?
Yes, I do.
Can you tell me what they are?
Sure. Red, orange, green, light green, dark green.
Very good. And do you see any numbers on this page?
Yes, a 7 and a 45.
Very good. And last one. Do you see any numbers on this page?
Yes, 16. And there's just a design on the right side.
Can I have you follow that for me with your fingers?
Sure.
Very good. No issues at all with color discrepancy, which is perfect. Just take down a couple notes here. Okay, do you have an optometrist that you're able to make an appointment with?
Not at the moment, no.
Okay, is that something that you'd like me to refer you to?
Yes, please.
Perfect. I will go ahead and do that for you. You can pick up that referral at the receptionist desk on your way out. Okay. So lastly, for our head and neck examination, I'm going to do a brief sensation test. Make sure you're not having any sort of sensory deficits in your head or neck, okay?
Okay.
So I have a couple different things that I'll test with. Let's start with something very, very soft. Are you able to feel this?
Yes.
Can you tell that that's soft?
Yes.
Okay, so I want you to say yes when you feel it. Go ahead and close your eyes for me.
Yes. 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 Yes.
Perfect. Are you able to feel this?
Yes.
Can you tell that that's sharp?
Yes, I can.
I want you to say yes when you feel it.
Yes. 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 Yes.
Very good. I'm testing for pressure sense. Are you able to feel this
Yes, I am.
and this?
Mhm.
Can you feel that they were slightly different?
Slightly.
Okay, so I'm just testing for pressure sense. Essentially, I want you to be able to tell me whether you can feel it lightly or deeper. You're just going to say yes, regardless of how hard you feel it, okay?
All right. Yes. 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 Yes.
Okay, very good. And lastly, do a very, very brief test for temperature. These are very slight differences, but can you tell that this one is not as cold Is this one?
Yes, I can.
Okay. So I want you to say 1 or 2.
Okay.
2 will be the colder. Okay.
1, 2. 1, 2.
Good job.
1, 2. 1, 2. 2. 2. 1, 1, 2.
Very good. Good job. That test is a little difficult because it is a very slight difference, but you did very good with that. All right, James. So I am going to go ahead and move over to have a look at your shoulder and elbow, okay? So give me a second while I just get settled.
All right.
All right, James. I'm over on your right side. Is it okay if I just move your shirt a little?
Sure.
Okay. Just gonna have a look at the outside of your arm to see if there's any notable abrasions or anything. It doesn't look like you broke the skin. Did you have any bleeding when you fell?
Just like a scrape.
Okay. Looks like it's healed up, which is good. Do you have any pain here?
Just a little with my shoulder.
Okay.
Yeah, kind of right there, whatever that tendon is.
Right here?
Yeah.
Okay. So do you feel just a little bit of swelling in there for sure? Does it hurt less as I go down?
Yes, it hurts less.
Okay. Inside of the elbow, painful at all?
No, it's not.
How about the outside?
Yes, the outside.
Okay. When you fell, did you hit your elbow? Did you like land on your arm?
I kind of landed on my elbow on my forearm.
Okay. It's a pretty typical injury for falling, unfortunately. We tend to brace ourselves with our wrists or our elbow when falling. Okay. Looks like you might have had a small abrasion here that healed up nicely.
Right.
So is the pain more here or kind of directly on the bone?
Closer to the bone.
Okay. Any pain in your wrist?
No.
Okay. And how about up kind of near your clavicle? Is all of that okay?
It's a little tight there as
Slight,
well.
just kind of discomfort.
Yes.
Would you say it's more painful here or here?
They might be even.
Okay.
They're equal.
I'm going to press a little more deeply. It might be uncomfortable. I'm just trying to feel for any specific injuries. So I'm suspecting you might have a very minor tear in that rotator cuff.
Okay.
Because I see the swelling kind of following down along your clavicle, down to the muscle that connects here. I'm going to do some extension of your arm. I want you to just kind of give me all of your weight here.
Okay.
And tell me when it becomes more painful, if anywhere.
It actually feels more painful as it's closer to my body.
So more painful
more
here.
Painful there.
Okay. So this is
Yeah.
probably a very uncomfortable
Yes.
one. Okay. Interesting. Okay. And if we bend at the elbow, is that uncomfortable or is it more uncomfortable if you flex out?
It's more uncomfortable bending.
It's more uncomfortable this way.
Yeah, it's not terrible though.
Okay. So it's definitely more painful in the shoulder.
Yeah.
Okay. You do have some slight redness here, and I'm definitely noticing a fair amount of swelling. It's not edematous, it's just definitely swollen to the area. Just doing some temperature testing. It's definitely a little warmer up here. And cooler as we come back. Elbow. Maybe very, very slightly warmer, but the temperature is more even throughout your lower arm, which is great. So I'm going to do some sensation testing of your arm. I want to make sure there's not any loss of sensation due to the swelling. So let's start with the same soft kind of cotton wisp that we used on your face. Can you feel this?
Yes, I can.
Okay. So I want you to say yes when you feel it, okay?
Yes, 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 yes.
Did any of that feel any less sensitive than other areas?
No, I didn't.
Okay. And then we're going to do the sharp. Can you feel this?
Yes.
Okay. So you might feel this or this. I want you to say yes either way, okay?
Okay. Yes. 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 Yes.
Any loss of sensation with that?
I don't think so.
And did that cause you any pain or discomfort?
No, not at all.
So let's go ahead and try something a little more obvious. So I have a metal wheel here. This is called a Wartenberg wheel. It's pretty sharp. Can you feel this? Okay. So I want you to just initially say yes if you feel it, and then we'll try something else, okay?
Yes. 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 Yes.
So now I'm going to bring this down across your arm laterally, and I want you to tell me if it feels any differently as we move down, okay?
Okay. Yes. And it does not feel differently. It feels the same. And there's no difference. No difference. No difference.
This feels the same as this,
Yes, it does.
and this, and this,
Yes, it does.
here and here,
Yes.
and then all this should feel the same.
Yes, it does.
And no difference up near your clavicle or on your chest.
No.
Very good. So I want to test for any signs of neuropathy. So I have a kind of plasticky bristle brush. So I have a kind of plasticky, rough bristle brush, and I'm going to be swiping this along your arm, so I'll show you kind of on your face.
All right.
I want you to say yes when you feel it, and if you feel any sort of tingling or burning sensations, let me know, okay?
Okay. Yes, I feel it. Yes, I feel it. Yes, I feel it.
She's going to jump on top of you, just ignore her.
Yes, I feel it. Yes, I feel it. Yes. 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 Yes, I feel it. Yes, I feel it. Yes, I feel it. Yes. Yes, I feel it. Yes, I feel it. Yes, I feel it. Feel it.
So any tingling, burning?
No.
Okay, so all of that felt okay. Very good. So let's go ahead and do testing for temperature. So I have two different globes here. One of them is slightly colder than the other.
Okay.
Can you tell the difference between this and this?
Yes.
Okay. So I want you to tell me when you feel 1 or 2, 2 being the colder, okay?
Okay. Colder? 2? Oh, no, that's 2. That's colder.
Okay.
1, then 2. 1, then 2. 2, then 1.
Very good.
2, then 1, I believe. 1, then 2. 1, then 2. Hard to tell with that one. 2, then 1.
Very good.
2, then 1. One more time. 1, then 2. 2, then 1.
Very good. Okay. So you did okay with that. I have another object here that is fairly cold.
Okay.
Can you feel this?
Yes, I can.
Okay. So I want you to tell me if this feels any different as I move down your arm.
It may have felt colder at first.
Colder at the beginning?
Yes.
Okay.
Yeah, colder in the beginning. Yep. Yeah, it feels more cold on my shoulder than it does on my elbow.
Okay, so colder up here. So this, compared to this, you would say this is colder?
Absolutely.
Here and here.
Yes.
What about here versus here?
Colder the second on my forearm.
Okay. And here versus here, same or different?
Same.
Here and here, same or different?
Same. About the same.
Okay.
Same.
Can you feel this?
A little bit.
Slight vibration.
Yeah.
You feel it here,
Yes.
here,
Barely.
barely here.
Yeah.
You feel it here?
Not too much. Yes, now I feel it. Yes.
Here. It all feel the same?
Yes, it does.
Okay. And can you feel it here just as much? Or does it feel less over here?
No, it feels more down there.
More down here?
Yeah.
Okay. more gentle percussing around the area here. Just testing for any abnormal reactivity. Is that painful?
No, it's not.
And up on the clavicle. Here.
No pain.
No pain. Okay. Lastly, I just want to test one more thing. Can you tell me if this and this feel any different than this?
They feel about the same. I just think there was a little bit less sensitivity on my elbow.
Less sensitivity, so you maybe feel this slightly more
Yes,
here than here.
that's correct.
So I want you to tell me at what point, starting here, do you start to feel it less?
Yeah.
Okay, here.
Mm-hmm. Yep, now. Yes.
Okay. So I do suspect that you have a fair amount of swelling in your elbow, also in the shoulder area, but it looks like more so here, which is why you're having a little bit of that lack of sensitivity.
Okay.
The swelling essentially is occluding your sensory perceptors from allowing you to feel things as much as you would in the areas where it's not as swollen.
Okay.
So I'm thinking we need to keep you immobilized for a few days. I would like to have you wear a brace. It's just a soft brace. It's nothing super compressing, but it will help keep your arm stabilized while it's healing, okay?
All right.
So I will get that on you when we are finished with the exam. I do want to go ahead and have a look at your knee because it sounded like you were having more trouble with your knee than you are with your shoulder.
Right.
Like you kind of mostly landed on your knee is what I
Right.
was understanding.
Mm-hmm.
Okay. So if I could have you sit up for me, I'm going to have a look at that knee. Go ahead and fix your shirt. Okay. All right, James. So it looked like we definitely have some swelling in your elbow.
Okay.
I have the sling for that, which I'll be putting on you at the end of our appointment today. So let me go ahead and have a look at your knee. And just kind of right off the bat, I do definitely notice some swelling in comparison to the other side.
Okay.
The measurements that I took showed about 1.5 inches difference on this side, which is kind of significant. Is any part of this particularly painful?
Just maybe right in the middle.
Right in the middle?
Yeah.
Okay.
Just a little, yeah.
So definitely noticing some swelling when I push in. Can kind of see that there's a delay there. Okay. When you fell, did you kind of kneel down on your leg?
Yeah,
or?
I did.
Okay. Just a little bit of joint manipulation here. Is this painful?
It's okay.
So luckily, it's definitely not broken. Nothing is dislocated or fractured. It's likely you've kind of just severely bruised the muscle here, which is why it's so tender.
Okay.
Any pain down here?
That's kind of where it hurts, yeah.
More so here.
Yeah.
Would you say this area hurts more than here? Or about the same?
About the same, but probably not. No, I wouldn't say that.
Okay. So this is the most painful?
Yes.
Let me just... Can I have you extend your leg onto mine?
Sure.
Is that uncomfortable for you?
It's okay now.
Okay. Definitely noticing some swelling here.
Yeah.
Is the back of your knee painful at all?
No, it's not.
None of this is painful or uncomfortable here. Okay. So I'm going to do a little bit of that sensation testing on your leg.
Okay.
Can you feel this?
Yes.
Okay, so say yes when you feel it, eyes closed.
Yes. 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 Yes.
Okay. Did that feel the same up here as down here?
Yeah, it did.
Okay. So now we're going to do the sharp.
Okay.
Yes when you feel it.
Yes. 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 Yes.
Did that feel the same top and bottom?
It did feel the same.
How about if I kind of move this down your leg, tell me if it feels any differently as we move down, okay?
No, that feels the same. Same. Same.
Okay. And here.
Yep.
Okay. Let's do some of that neuropathy testing. So same thing with the brushing motion. Tell me any stinging or burning, okay?
Okay.
Oh, that felt pretty normal.
Yeah, that all feels fine.
Okay. So let's do our sharp sensation here. Are you able to feel this?
Yes.
Okay. Tell me if it feels the same going across.
Yep, it does. Yes. Yes, the same. Yes. Yep.
Okay, so let's go ahead and try something cold. Are you able to tell that this is cold?
Yes, I can.
Okay. Does it feel as cold here
Yes.
as well as here?
A little less cold there.
Here? Here?
Less cold on the second one.
Here? Here?
About the same.
About the same. So here, a little bit less.
Yeah.
Okay. So I bring this down. Does that feel different down here?
Right at my knee, my lower knee, it doesn't feel as cold.
Right here?
Yes.
Interesting. Okay. How about from this side?
Yeah, same thing.
Okay. So We're having a little bit of that loss in sensation from about here to here.
Yeah, that's about right.
Okay. Now I want you to tell me if you feel one globe touching you or two at the same time.
All right.
Okay, so one or two.
Okay. One, two, one, two, 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 one, two, one, one, two, two, one, two, two, one, two, two.
Okay. So you're definitely having some loss in this area.
Okay.
Okay, so I'm gonna do a little bit of reflex testing here. So just kind of relax your muscle. Try not to hold your leg up. Just completely go flaccid for me. Okay. There's a little bit of delayed reaction. The reactivity in your ankle and foot is normal, but there's a slightly delayed reaction here in your knee, likely due to the swelling. So the good news is I don't think there's anything serious going on. I do think you need some ice therapy. Have you been icing your leg?
Off and on.
Okay. So I'd like you to ice it for a total of 1 hour a day in 15 to 20 minute increments, okay? So if you can do 15 to 20 minutes in the morning and then in the afternoon and at night,
Sure.
It would be ideal just to bring down some of the swelling. Stick with the Aleve to help with the pain or inflammation. I don't see why you would need any weight-bearing restrictions. You should be able to walk normally unless you're feeling painful or uncomfortable. Then you can kind of shift your weight to the other leg. I do want you to keep weight off of this arm for 2 days. So I will give you a sling for that. Because you're having the increase in swelling in this area, I do want to wrap this. So it's kind of like a lymphedema wrap. It's essentially going to compress your leg to help redistribute some of the swelling, okay? So it'll compress this area and kind of force the swelling up and down so that it's able to heal more evenly. And then I also have a knee brace that we can try. Okay,
cool.
So let me go ahead and get your supplies. I'm going to have you just bend your leg here. So I have a flex wrap here for your knee. And this is the sling for your arm. And got a couple different things here. This is an instant ice pack. So I can have you re-extend your leg for me. We're just gonna relax here. Is that okay for you?
That's fine.
Okay. This is gonna feel a little tight. I'm gonna wrap it with the ice pack. How long is your drive home?
About 25 minutes.
Okay. So we'll leave this on here till you get home. When you get home, you can unwrap it.
Okay.
It's just gonna start that initial phase to reduce the swelling, and then I want you to wear the knee brace anytime you're out of bed for the next 2 days, as well as the sling. Okay? Obviously, you can take it off to take a shower, but then go ahead and put it back on. Okay. Okay, how is that? It should feel tight, but not uncomfortable.
That's good.
Okay. This is a flexible knee brace, so it gives you all of the regular mobility, just a little bit of added support. It also provides some of that compression to help with the swelling. Put it on. Obviously, you want the hole going right where your knee is. Your knees around, and you want it to be taut, but not so tight that you can't bend your leg.
Okay.
And go up and under. And then these straps will come around the back. Go ahead and relax your leg. How does that feel?
Feels good.
Does it feel like it's too tight?
No.
Okay, looks great. So I'm going to show you how to use the sling. And essentially this is just forcing you to be immobilized so that you can't move it in an awkward position to keep it in place so that you can heal that tear, okay? So once I place it, it's going to be measured for your injury. So to take your arm out, I don't want you to undo it.
Right.
You just kind of lift your arm up and then untuck. Okay. So go ahead and raise your arm for me. Okay, and I want you to bring your arm across just like that. Now let your arm hang down. That feels supported,
Yeah,
but you can't force it down.
Right.
Okay, so then to take it off, you're going to raise your arm up and just pull it out like this.
Okay.
Okay? All right, so you should be good to go.
All right.
Hope you're able to get home safely.
Thank you.
You want to leave this on for 48 hours as well as the brace. Obviously, you can take them off to sleep and shower, but other than that, you should have them on.
All right.
Okay? The wrap can come off as soon as you get home.
Gotcha.
Okay? Well, thank you so much, James. I appreciate you. I hope you feel better.
All right. Thank you.
Have a good day.
You too.